Hi everyone, welcome to the Introduction to Occupational Health Part 1. In this part of the chapter, we will be discussing the occupational health historical perspectives. Subtopic to be covered includes definition, focus and objectives of occupational health, and significant figures in the history of occupational health. With that, at the end of this part of the chapter, you are expected to be able to describe occupational health generally and recognize several significant figures in occupational health history. An official definition of occupational health has been introduced by the Joint Committee of International Labour Organization (ILO) and World Health Organization (WHO) in 1950 as the promotion and maintenance of the highest degree of physical, mental and social well-being of workers in all occupations by preventing departures from health, controlling risk, and the adaptation of work to people and people to their jobs. In the committee meetings, they have outlined the focus of occupational health, specifically addressing the three elements, which are health promotion and disease, accident and disability prevention at the workplace, and lastly, the necessity of treatment after the occurrence of the injury or disease. In due course, according to the ILO Committee on its 12th sitting, occupational health have three main objectives, which are health promotion at the workplace, improvement of workplace condition, making it more suitable to the worker, and the development of a proper work organization and work culture supporting the occupational safety and health programs. The history of occupational health started a long time ago, where it started in the form of social changes during the age of antiquity, Middle Ages, and Renaissance. The timeline starts when human was a hunter and gatherer during the Stone Age, changed into farmers so that they can have food source close to home. When they produce more than their needs, they start selling by firstly conducting a small-scale manufacturing at home called a cottage industry. They trade goods with people in the community using barter system, where they change items between them without using money. Eventually, the food products are abundant and they need to get rid of it before it will become inedible. So people from around that time need to travel to other nearby towns to sell the product. When there are lots of demand from the nearby community, they decided to mass produce. They also changed the barter system with money exchange instead due to the uneven worth of barter system. Consequently, they build factories so they can mass produce to meet the demand. Booming of factories offers stable jobs and income, resulting in the overcrowding due to urban migration and creating an industrial town. Now, let's start to get to know several significant figures in history that makes occupational health policy possible in the history of Industrial Revolution. There are many of them, but we will focus on several that contributes to the development of occupational health particularly. Firstly, we will learn about Paracelsus. He was born in Switzerland and he is also known as the father of modern toxicology. He was a traveling scholar and later be a traveling doctor, a chemist, physician, and hold a position of a professor in physics and surgery. He established dose-response relationship theory and described disease among miners and smelters. According to Paracelsus' dose-response relationship, he described it as all substances are poison. There is none which is not a poison, but the right dose differentiate a poison and a remedy. Next, we will learn about a German geologist, which is Georges Agricola. He was the father of modern geology in Germany. He wrote a book called Terra Metallica, where he described about disease among miners in 1527. One of the captions of the book is, "Some mines are so dry that they are entirely devoid of water, and this dryness causes the workmen even greater harm, for the dust which is stirred and beaten up by digging penetrates into the windpipe and lungs, and produces difficulty in breathing, and the disease which the Greeks call asthma. If the dust has corrosive qualities, it eats away the lungs and implants consumption in the body. Hence, in the mines of the Carpathian Mountains, women are found who have married 7 husbands, all of whom this terrible consumption has carried off to a premature death." Let's move on to the next significant figure in occupational health, the Italian doctor called Bernardino Ramazzini. Ramazzini was a father of occupational medicine that first recommended other doctors to include the possibility of occupational effects on their diagnosis. He wrote a book called De Morbis Artificam Diatriba, where the caption includes, "When a doctor visits a working-class home, he should be content to sit on a 3-legged stool if there isn't a gilded chair, and he should take time for examination, and to the question recommended by Hippocrates, he should add one more, what is your occupation?" Next one is an English physician called Percival Pott. In his wide experience in medical field, he had associated soot to be the cause of scrotal cancer among chimney sweeps. He believed that the scrotal cancer patients during that time shares one thing in common, which most of them work as chimney sweeper and exposed to soot all day long. Next, we are going to learn about the father of occupational medicine in the English-speaking world, which is Charles THACKRAH. He developed a guideline for the prevention of certain diseases. He also advocated the elimination of lead as a glaze in the pottery industry. THACKRAH also emphasized on the use of ventilation and also respiratory protection to protect knife grinders. He advised to change the work practice and the workstation design among tailors to eliminate cramped posture, which can contribute to high prevalence of tuberculosis in their profession. The most important part was he contributed to the passing of the Factory Act in 1833 and Mines Act in 1842 in the purpose to ensure the safety and health of the workers. The last one is the significant figure of occupational health in the United States of America was Alice Hamilton. She noticed the effect of exposure to lead among American workers and documented her work in her autobiography called Exploring the Dangerous Trades in 1943. Now, let's recap what we have learned. Occupational health can be described as the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations by preventing departures from health, controlling risk, and the adaptation of work to people and people to their jobs. Several significant figures in the history of occupational health includes Paracelsus, Agricola, Ramazzini, Pott, THACKRAH, and Hamilton. Now, as you already can describe occupational health generally and recognize all the significant figures in the history of occupational health, we will look into the development of occupational health in the era of Industrial Revolution. See you again in part 2. Bye for now.